Hello, future doctors. I welcome you all in a brand new video of toxicology. Today, we are going to study each poison in detail. So, first poison that we are starting is corrosive poison. As soon as I say the word corrosive, the first thing that comes in mind of everyone is acid. That is not always true. Corrosive includes both acid as well as alkali. And we are going to study in further detail that alkali are more dangerous than acids. How they are more dangerous than acid? Now we are going to study that first. So the acid and alkali both causes necrosis, but different type of necrosis. What is the type of necrosis that the acid causes is known as coagulative type of necrosis, whereas the alkali causes liquefactive type of necrosis. We have already studied the necrosis in second year pathology chapter, the coagulative and liquefactive type of necrosis. So because of the coagulative type of necrosis, there is an eschar formation. There is an eschar formed in an in acid poison, whereas there is no eschar is formed. There is no eschar is formed in the alkali poison, and because of the eschar, the eschar prevents the further damage of the tissue. It prevents the further damage of the prevents further damage of tissue. Whereas there is no eschar formation, so there is deeper tissue damage. So we have seen that alkali are more dangerous than acids. We have said that all acid forms a coagulative type of necrosis, except there is one exception in the acid, that is HF, that is hydrogen fluoride. This acid causes liquefactive type of necrosis. Liquefactive type of necrosis. HF is generally used in glass industries. So, person working in glass industries can maybe accidentally causes the HF poison. In this particular video, we are going to discuss about the acids mainly. What are all acids we are going to study are sulfuric acid, nitric acids. We are going to study about the carbolic acid, which is nothing but phenol, and we'll see little about oxalic acid. These are the four main acids that we are going to study in this particular topic. So first we are going to start about from the sulfuric acid. Sulfuric acid. Sulfuric acid is also known as the kings of acid, is also known as oil of vitriol. Is also known as oil of vitriol or also known as battery acid, as it is used in car batteries and inverter batteries. So sulfuric acid has particularly two properties. Sulfuric acid contain first is carbonization, and second one is hygroscopy. Hygroscopy. What is carbonization? What is hygroscopy? Carbonization is nothing but charring. It causes charring of the tissue in whatever tissue it comes in contact. What is hygroscopy? That it absorbs moisture. It absorbs moisture and makes the area dry. So these are the two main properties we are going to see in the following sulfuric poisoning. Now we are going to study about some signs and symptoms related to the sulfuric acid poisoning. What if a person or a patient comes with the following symptoms? We can suspect sulfuric acid poisoning. First of all, the signs is extreme pharyngeal pain. There will be high amount of pharyngeal pain. There will be dysphagia in this particular patient. Dysphagia. Their lips will be swollen. Lips will be swollen. There will be black or brown colored streaks on the angle of mouth. Angle of mouth. If this is a face and this is a mouth, there will be black or brown color streaks over there due to ingestion of the acid. These are the some signs and symptoms. These signs are present in the particular patient. We can suspect that the patient has undergone sulfuric acid poisoning or has ingested sulfuric acid. These were due to the property carbonization. What will be the signs caused due to hygroscopic nature is the chalky white appearance of teeth. The teeth will become chalky white in color. This particular sign and symptom is due to the hygroscopic nature of the sulfuric acid. Now we have seen some signs and symptoms of the sulfuric acid poisoning. Now what if the patient died and now the body came with the particular signs? So what are the post-mortem appearance of the sulfuric acid poisoning? First, externally, we will see the corrosion of the mucous membrane. The mucous membrane of the lips, mouth, and even hands will be corrosed. We have already studied that the acid causes necrosis, and what type of necrosis? You will comment down the what type of necrosis. So the necrosis first will be appeared as grayish white, but soon it will convert into brown or black colored area, necrotic area. Now internally, the effects of the poison are limited only up to upper digestive tract. Only upper digestive tract and respiratory tract is affected. Is affected. Nothing beyond the level of the what we'll say pylorus is very very rarely affected in sulfuric acid poisoning. What will be the findings in internally? There will be several interstitial hemorrhage. Several interstitial hemorrhages would be seen. There will be a perforation of mucous membrane of stomach. It is very rare actually, but it can be seen. The perforation of the mucous membrane is very rare, but it could be seen. Like perforation of esophagus is also very rare. Of esophagus is also rare, but can be seen. As well as the perforation of diaphragm. Even the diaphragm could be affected due to the sulfuric acid poisoning, but the perforation of the diaphragm is also very rare. The whole mucosa of stomach will be turned into black or blackish or brownish in color. Blackish or brownish. Now the main question arises that why are we studying about the sulfuric acid poisoning? What is the significance or medico-legal significance in the term of forensic medicine? What are the medico-legal significance? It can be this poisoning can be an accidental poisoning. It can be either an homicidal poisoning or it can either be a suicidal poisoning. There is a one very important term. Like we have already learned, the sulfuric acid is also known as oil of vitriol. So from that word vitriol, there is a term known as vitriolage. It's a very important term and very serious case during in India, that is throwing of acid. It's a punishable offense and it is very dangerous. To treat the particular patient, you have to follow those 5 steps that I have explained in previous video. If you have not watched that particular video, you will find the video link in description. But what is a particular or peculiar treatment for the sulfuric acid poisoning is that affected part is washed out with the water or soap, or in even some cases the potassium carbonate is used. Potassium carbonate is used. That's all you have to learn about sulfuric acid. Now we are going to start the next acid, that is nitric acid. Nitric acid is a colorless. Just mark the point, colorless. It's a colorless liquid. It is also known as aqua fortis. It's also known as a nitric acid is also known as aqua fortis, and whereas sulfuric acid is also known as oil of vitriol. So it's a very strong oxidizing agent. Just mark every properties that I'm writing. It will be useful in some ways. So I have wrote two properties, that is colorless liquid and then oxidizing agent. It's in colorless. Why it is an important property, oxidizing agent? Whenever the nitric acid come in contact with organic matter or organic things, so it reacts with the protein inside of it and forms picric acid, which is yellow in color. So the colorless liquid has turned into yellow. This is nothing but very famous xanthoprotic reaction. Xanthoprotic reaction. Why it's protic? Because it reacts with the protein inside of the organic matters. So it can be used to detect or identify or detect the proteins or organic matter in any sample. In any sample. There is one more important property, that it is a fuming liquid. It forms fumes. So the inhalation of these fumes of the nitric acid can be more dangerous. So what will be the appearance of a body? That is PM appearance. There will be a yellow staining of the clothes, and even the tissues. Even the tissues will be yellow in color. Yellow staining of tissues. Then there will be a abdominal distension. Abdominal distension will be present. Why abdominal distension will be present? Because of the fuming nature, because of the gas production. There will be abdominal distension. Due to the inhalation of the fumes of the nitric acid, there will be the congestion of the larynx and pharynx. Larynx and bronchus. There will be the congestion, so the patient will die due to asphyxia. So because of the congestion, there will be an asphyxia. So asphyxia could be a cause of death due to the nitric acid poisoning. The mucous membrane of the stomach. Mucous membrane of stomach will be, that will be brown or black in color. Why not yellow? Now you will ask why this will be brown and black in color. Whereas the mucus is also, the stomach layer is also of protein. Why not yellow? So brown and black due to presence of acid hematin. Due to the presence of acid hematin, this will be in brown and black appeared. These were the things that you have to learn about the nitric acid. Now the main, carbolic acid. Carbolic acid is also known as phenol, that we use very common in our home. The phenol is usually or naturally in the crystal forms. They're white or clear crystal. But as soon as it uh, is exposed to air or oxygen, whatever we call it, it will convert into pink colored liquid. The crystal liquefies and forms a pink color liquid. The carbolic acid is slightly or little soluble in water. Soluble in water. What are we use carbolic acid very often in our home? What are some derivatives that we use, like Dettol, Lysol, and even menthol is derived from the carbolic acid or phenol that we use in our daily routine. Why phenol poisoning is very important? Why phenol poisoning is very dangerous? It is because it can be absorbed from any root. It could be absorbed from any root. Like it can be absorbed from alimentary canal, even from vagina, even from intact skin. From intact skin, it can be absorbed. That much dangerous the carbolic acid is. Carbolic acid shows both type of local effects as well as systemic effects. We have to discuss both. First, we are going to discuss the local effects of phenol poisoning. What are the local effects of the phenol poisoning? That as soon as it comes in contact with the skin, it will cause severe burning sensation. Severe burning. Then after some time, it will become painless. Anesthesia will occur. Why? Because due to it causes destruction of the sensory nerves. Sensory nerves. Same as if the patient has ingested if the patient has ingested the carbolic acid, same with the stomach mucosa. First there will be very burning sensation, very painful sensation. After that, anesthesia will be achieved. In this type of poisoning, in carbolic acid poisoning, there will be decreased emesis. Decreased emesis. Emesis means vomiting. There will be decreased emesis sensation. Why? Because of the destruction of the sensory nerves. It will also causes the edematous of laryngeal and pulmonary. It also causes pulmonary and laryngeal edema. These were the some local effects of the carbolic acid poisoning. Now we are going to study some systemic effect. The one of the major systemic effect is phenol is a CNS depressant. It depresses the CNS function, especially respiratory centers. So it can causes asphyxia, which leads to asphyxia and which can lead to death. Now for urine formation in urine, it's a very important point, double star mark point. In our body, phenol is converted or oxidized into hydroquinone. And this hydroquinone is then this hydroquinone is then excreted in the urine. But in the further oxidation can cause the urine to convert in green color pigment. Then the green color urine excretion will be because of the excessive oxidation of the hydroquinone. Excess oxidation. And this thing is known as carbonuria. Carbonuria. That is what is carbonuria? Is a green color urine due to the presence of hydroquinone and the oxidation of the hydroquinone. These hydroquinone and pyrocatechol, hydroquinone and pyrocatechol, they can also cause pigmentation of cornea. They can be deposited in cornea and can cause the pigmentation of cornea and cartilage. In bones, in bone joints, in joint spaces, they can get deposited and cause pigmentation of them, and this is known as ochronosis. Ochronosis. These were some effects and local and systemic effects of the carbolic acid. Now we are going to learn about the treatment. The treatment would be same according to the previous video, but we have learned a particular exception for the gastric lavage, that we can use gastric lavage in carbolic acid poisoning. Why we can use gastric lavage? Because it turns the stomach mucosa into leathery. Stomach mucosa to leathery. So there will be no risk of perforation in carbolic acid poisoning. No risk of perforation. So we can safely use gastric lavage in the case of carbolic acid poisoning. For carbolic acid poisoning, I want you to learn a very important point, that it delays putrefaction. In a very bold and important point, I'm saying it delays putrefaction. Why and how it delays putrefaction? Because phenol is antiseptic. It has antiseptic properties, because due to which there is a less growth of bacteria and hence the delay of putrefaction. Now last but not the least is the oxalic acid. Oxalic acid, it's a crystal form and which resembles magnesium sulfates, crystal of magnesium sulfates. It is generally used in bleach and in brass and copper factories to clean them. So the workers working in these type of factories are exposed, more prone to oxalic acid poisoning. Oxalic acid also have local as well as systemic effects. Local, what are the local effects? There is very rare case in which skin will be burnt. Skin will get necrosis or corrosion of the skin is very rare. But mucous membrane of the stomach is corroded. Mucous membrane is corroded. Now let's come to the systemic. As soon as the oxalic acid is absorbed in blood, it reacts with calcium and it's bind with Ca2 plus and hence causes decrease in calcium concentration. So and hence causing hypocalcemia. This is one of the more major cause of death due to oxalic acid. Oxalic acid also causes necrosis of the nephrons. It causes necrosis of the nephrons and hence causes renal damage and hence from renal damage hence causes death due to uremia. So these were the few corrosions, few acids that we have studied, and that's all we have to study. Thank you very much.